Good morning, everybody. It's Thursday, August 13th. It's Mike, Michelle, and Marie with another employee update for you. You're going to hear from Marie about what's going on around Monroe County and the most recent case we had over at the Summit Walk. Michelle will touch base on some of the nursing challenges and some other good information for all of you to hear. I wanted to spend just a few minutes talking to you about a couple different areas. First is our Leon Rosen Award. If you're not aware about this award, it's a recognition we do for exceptional customer service. Unfortunately, during this pandemic, we weren't able to get everyone together to do have a really great event and ceremony for all of the nominees and winners. But I wanted you to know we had over 50 employees that were nominated for the Leon Rosen Award and 2 winners, and I'll mention those 2 winners in a second. But Leon Rosen was a resident here. I started 15 years ago, and Leon came shortly thereafter. And he was all around about doing exceptional customer service. He used to say the thing, just take the extra second to do it right. And we've had over 50 employees recognized for taking the extra second to do it right. So thank you all very much. I'm really happy to announce that Wanda Osborne, certified nursing assistant, actually a CNA 3, been with us a long time, great employee, is one of the winners. And then Tammy Redman, a PTA, is the other winner. So congratulations to both of you. And to all the nominees and winners, besides the gift certificate and the other stuff you're going to be receiving from the organization, we're doing something a little bit different this year. We're going to give each one of you a chance to have your own brick at no cost out here in our donor brick area. So you'll be able to write an inscription, maybe in memory of someone, in honor of someone, or even about yourself, but you'll get a chance to have your own brick out here on our campus. The foundation will be reaching out to you so you understand a little bit more about that as well. The mass testing that we've been doing for all of you has continued across the campus. The governor has also renewed the order, so we will be continuing with the weekly testing. Right now, we've done over 6,300 tests across the campus. That's the Wolk and the Lodge, and then over here at the Jewish Home and the cottages. And we've had 4 employees that have come up positive from the mass testing. And as a reminder, we've had 12 employees, unfortunately, get infected with COVID. So the mass testing is not really identifying the numbers that I think the governor had hoped it would identify. What's even more important is for those of you that have symptoms and you're calling in and telling us you don't feel well, that's really, really important. Because that's how we're finding the bulk of the cases, the few cases we've had here at the Jewish Home. And unfortunately, the governor still hasn't announced any mechanism to pay for these tests. So for our organization, the 6,300 represents about $600,000 that we still haven't figured out how we're going to pay. Hopefully some money will be coming from the federal government or the state to help offset that huge burden that we're facing. On the nursing side, I know Michelle is going to touch base a little bit about this, but, during the pandemic, we've encountered some increase in our vacancies on the nurses and the certified nursing assistant positions, especially here at the Jewish Home and the cottages. I just want you to know that these positions, each of you, and for those of you that aren't in nursing, are critical to the success and quality of our organization. There's a reason we're called a nursing home. It's because we have nurses and nursing assistants. You guys are here to help protect and care for the most frail and vulnerable in our organization. And I appreciate everything you're doing every single day, every single hour. So we're not taking these vacancies lightly. It's really kind of all hands on deck about how we can help move the needle. We think that this is definitely a short-term issue. We've got a lot of applications and hiring in the pipeline, but Michelle's going to talk more about exactly what that's going to mean as we help support each of you as you help take care of our residents. Thank you.
Hello everyone, just a few updates. As you probably are aware, Rochester continues to do well in terms of the number of active COVID cases. We're around 380, and we have a very small number in the hospital, about 30 to 40. There's about 20 new cases a day in Rochester. And one interesting fact is that the age group that is coming down with the new cases are in the 20 to 30 age range for the most part. Reason for this, hard to say, but may have to do with group gatherings. And as you're all aware, group gatherings such as parties or picnics or bars remain the highest risk for coming down with COVID. A couple of other just small updates. As you're probably aware, there was a positive employee on campus who was detected on the routine testing. This person was asymptomatic, and this occurred down at the lodge. So the employee is home for the next couple of weeks, and the good news is at this point, all of the lodge residents have tested negative. All of the employees who worked with this employee have tested negative, and no one is showing any symptoms. So we are keeping a close eye on that situation for the next couple of weeks. The only other topic, I think I've talked about this before, is the hot states, quote unquote hot states. There are now 30-some states that have very high numbers of COVID cases. And now that it's summer and vacation season, people do tend to want to travel. So what does that mean? When you do visit, or if you do visit these states, which I do not advise, but some people have, strong reasons for these visits, be very careful of any type of group gathering, wear your mask whenever you're out in public. And when you come back to Rochester, before you can come back to work, you do need to have a COVID test, which we can do here. Greg can schedule you and do that test here. And that has to be negative before you come back to work. After you come back to work, wear your mask at all times, and remember that for 14 days after you return, you could still be at some risk of developing COVID illness. We've also looked over the issue of families who want to visit their end-of-life loved ones when they're traveling in from these hot states. And we've actually gotten clarification from the New York State Department of Health about this, because I guess it's a problem for a lot of nursing homes, that by the regulation, these family members are not supposed to come into the nursing home until they've quarantined for 2 weeks, but they obviously can't do that because their loved one is very ill. So we have found that the family member can apply for an exemption, and we do have the website that social work can direct them to. They apply at the website, and usually within a day or two, they get an exemption form so they can visit their loved one in the nursing home. Otherwise, they are not allowed to visit their loved one, even at end of life, if they're coming for one of these 30-some states with high COVID illness. Keep doing everything you're doing. We are remaining with our residents COVID-free, and our employees, by and large, very healthy. So thank you for what you do every day.
Good morning, everybody. We're here again with another update. Mine is going to be fairly quick. Just a couple of things, one around COVID, and I'm sure you heard from Marie. We had one positive employee at the Wolk Manor. We've had no new cases here at the Jewish home. Both our visitations are reset, the 28 days. So the Jewish home hopefully will open up to visitation on August 29th, and the Wolk Manor will be September 8th or September 6th, I believe. So hopefully our families and our residents will be able to get together soon. It's been very, very stressful for everybody. And the second update is around recruitment and retention. I just want to share some numbers of folks that we have hired. Our HR department is doing a phenomenal job. Since January, we hired 27 nursing assistants, 19 nurses, and 16 culinary assistants. Now, most of those folks, or right now, we have about 15 people in training, orientation, so it doesn't really reflect in the numbers. So we are having some challenges with our staffing upstairs, especially in the tower, some out in the cottages. And the reasons are that we've shared before is schools and testing sites were closed. They are reopening now. People are COVID scared. They don't want to work in healthcare or nursing homes. Unemployment and the extra benefit, the $600 that people were able to claim. So I just want to thank everybody for welcoming all our new employees and continuing to be supportive in the training that is very meaningful to all our new employees. Lastly, want to let everybody know we are looking at ways to support our nursing staff, at least in the next couple of months until this gets better, that we have more folks to care for our residents. So the few initial plans will include, we're going to deploy our Help on Demand program, and that'll be on a scheduled basis. Christine and her team will send out more communication around that. So what you can help with, this program is doing laundry, help with feeding assistance, errands, taking residents to appointments downstairs at the clinics, whatever the support that nurses or nursing assistant will need, all of you will be very, very helpful. I'm also doing a volunteer recruitment of leadership to come in on weekends, so I'll be sending out text messages to people that want to come in and help support the staff. Also going to do some med training for our non-clinical nurses. That's maybe about 10 people, I'm not really sure how many. But that will also be another way to support the staff. I also been contacting some retired nurses that used to work here at the Jewish home to see if they would be interested in coming back for a little while, even if it's not a nurse capacity, but some way that they could do different duties, or if it's culinary or nursing assistant, whatever that they're able to do. So that's all I have for today. I just want to thank you all very, very much for all that you do every day for our residents.
In closing, I want to just talk a little bit about the issues that have been going on around our country outside of the pandemic, but really related to the pandemic. I touched base on this a few weeks ago, the unrest, the rioting, the racial injustice that's happening in our country. It's happening in New York State and here in Rochester as well. I'm aware of it. I'm sure all of you are aware of it as well. You know, anti-Semitism, bigotry, racism, discrimination against our LGBT community is unacceptable. You know, our organization is all about welcoming everyone. But quite honestly, I think we need to do a better job with it. And what I mean by that is we need to have systems and procedures and policies that clearly identify us as a welcoming organization to anybody, any race, any religion, anybody who wants to come and work here or live here. So I will tell you there is going to be a much stronger emphasis placed on this, especially in 2021. We've had conversations at the board level. They're all in agreement. You'll hear more about it as we kind of put this all together and what it's going to mean. It certainly won't mean we're going to flip a light switch, but I just want you to hear my commitment that inclusion and diversity is really important to our organization. I know it's important to all of you, and it's important to me personally. Thank you.